September is Childhood Cancer Awareness Month, and we are profiling a local family who recently grew by one. Amari and Katie Martinez already have a 3-year-old son, and in late July, they welcomed in a brand new daughter, Penelope. And just as they were getting settled in, it was Penelope's grandmother who noticed that something was not right.
So she was about 3 weeks old, and you're just tired. We already have one, we have a newborn, and we're trying to remember all the stuff. And my mom noticed her left foot was like a drop foot, like it just wouldn't do anything.
A trip to the pediatrician, referrals to orthopedics and neurology, then physical therapy, a sonogram, and finally an MRI confirmed the diagnosis and the family's worst fears.
It's actually a mass in her abdomen, and that's what's pushing on her spine, and that's when our entire world just shifted at that point.
At barely 4 weeks old, Penelope was diagnosed with neuroblastoma, a rare cancer that affects mainly children and forms in the nerve tissue.
There's about a little under 700 new cases every year, and it's the most common extracranial solid tumor that we see in infancy.
So far, Penelope has undergone 2 rounds of chemotherapy and will continue treatment every 3 weeks. According to Dr. Rodriguez, the overall survival rate for intermediate risk neuroblastoma is over 90%. And for those that present with spinal compression, as in Penelope's case, there are some studies that show up to 73% of patients will go on to have complete resolution. An additional scan in October will determine how well she is responding to the chemo.
I think as a mother, they're just these little miracles. And she still is, and both of our kids and their strength give a lot of strength to us. I think as a mother and as a parent, you always want to be everything for your kids, and it's really hard.